Hello, and welcome to the seventh episode of Unmasking Covid, a podcast that aims to share personal stories during this time of uncertainty. Today, we are joined by Nick Quinn and Madeline Randolay from FIMRC, or FIMRC, or known as the Foundation for International Medical Relief of Children, a nonprofit organization focused on providing healthcare for medically underserved communities worldwide.
Nick is currently the Field Operations Manager at Project Baduda in Uganda. He graduated from University of Wisconsin-Madison with a bachelor's in economics and has served as a Peace Corps volunteer in the western region of Uganda prior to joining FIMRC. During his times as a Peace Corps volunteer, Nick focused on areas of improved home agriculture practices and nutrition, financial literacy, and empowering youth through business and entrepreneurship. He also enjoys bike touring, backpacking, podcasts, reading, and ice cold spot at camp.
Madeline is the Interim Director of Global Operations at FIMRC. Prior to working with FIMRC, she worked as an admissions representative for Alma College, where she enjoyed focusing on helping first-generation and low-income students reach their college goals. Since joining FIMRC in 2016, she has used her skills to grow FIMRC's chaptership program, internship program, and alumni program. Madeline has traveled to Rwanda with a program similar to the Global Health Volunteer Program, which is what introduced her to FIMRC.
So I guess to start off, could you tell us a little bit more about FIMRC and the kind of services you offer?
Sure, absolutely. So as you mentioned already, FIMRC is a 501c3 nonprofit organization. We were founded in 2002 with our first site established in 2004 and have since grown to operate in 9 different countries around the world with a total of 10 different project sites. Our services that we offer really depend on the community's needs and priorities where we work within those 10 different project sites. They really focus on 3 main aspects: access to clinical care. So at most of our project sites, we provide some sort of clinical services focused on preventative health and primary care. So for example, in Project Baduda, which we have FOM Nick here with us, we see approximately or over 300,000 patients a year, or 30,000 patients a year, my bad, with our outpatient department and maternity ward. The second pillar is education. And so every single project site where we work is incorporating different kinds of health education services for the community. And so it really depends on what the community focuses on and what their priorities are. But you can see overall themes throughout all of our FIMRC project sites, things like nutrition, maternal and child health, non-communicable diseases like diabetes and hypertension, mental health, at times, depending on the site, infectious diseases, and things like that. And so an example of that is our diabetes and hypertension clubs, where members meet weekly to monitor their glucose and blood pressure levels, as well as build upon their knowledge to manage their respective diseases. And then the third pillar is participation, where we really incorporate outreach programs and partnerships with local organizations, health facilities, and different institutions. And so, for example, we partner with a lot of different schools at our project sites for different health education purposes and things like our health promoter programs. So those are just some examples of services we offer at different sites that are kind of broken down into those 3 pillars to achieve our overall mission.
Yeah, that's really interesting. FIMRC is doing a lot of things to really benefit and uplift our society and the world at large. But could you tell me a little bit more about your individual roles? As in, can you elaborate on them?
Sure. Nick, if you don't, I can go first and then have you go. So my role within FIMRC has really evolved over the 4 years that I've worked with FIMRC's headquarters office. I started out working with our chaptership program, alumni, interns, MPH students, working with our social media. I've started incorporating more and more site support work as well throughout my 4 years because my background is in international development. And so now, really in response to COVID-19, we've refocused our volunteer program efforts to virtual volunteer programs. And so that's really one of my main focuses now, as well as my role as Interim Director of Global Operations to help oversee with our FOMs, or Field Operations Managers, the operations of our FIMRC project sites.
For my role as the Field Operations Manager at Project Baduda in Uganda, I maintain and oversee operations and logistics around site activities that we have there. So kind of some main areas of focus for myself is based around one, volunteer management. So under normal circumstances, we'll have volunteers that will come to our site for varying lengths of time. Maybe it could be a week, it could be several months. So working with headquarters staff to make sure that we're prepared to receive our volunteers at our guest house and at our clinic facility, as well to making sure that we meet certain project requirements, if there are any, for our volunteers coming in, and see how best fit they are for some of the activities within our clinic or our outreach activities. Like Madeline said, we focus a lot on health education and community outreach. So we have a fantastic site team in Baduda there. So we work together on health education programs. What needs can we serve within our communities with our outreaches and education? It might be working with schools and partnerships around immunization, sanitation projects, awareness and HIV focused activities, and a variety of other things, as well to the kind of overall project management activities at our clinic. So we have the operations that could be around the budgetary activities, the reporting aspects of things, and planning out for future activities and events, and how that all works together on site, both with our staff, because our clinic supports staff of about 30 individuals and then about 50 or so community-based volunteers that we work with. So working to organize with our different members of departments and our leadership team to make sure all those operations run smoothly at the clinic.
Great. So I know, Madeline, like you mentioned, that you guys are now moving towards virtual volunteer programs. This as an example, or if you have any other things to address, what do you think is the impact of COVID-19 on your specific site?
So I think, from an HQ or headquarters standpoint, COVID has had an enormous impact on FIMRC's operations in general as an organization. As Nick mentioned, our volunteer program is a huge point of how FIMRC operates, and 90% of our revenue really comes from our volunteer programs and sustains our operations as a nonprofit organization. And so, of course, with the quarantine measures in place and the inability to travel, that has really hit our volunteer programs and consequently has hit our revenue stream as an organization. And so in terms of the impact, it really has had a huge impact on what we're able to do. But FIMRC really, as an organization, is very nimble. And being a small organization, we are able to act quickly and think quickly and work together. And so I think that we've had some really great successes at different project sites on addressing COVID and being able to continue operations as much as possible. And so I don't know, Nick, do you want to talk a little bit about Baduda specifically and how COVID has impacted Uganda?
Absolutely. One of the bigger impacts for myself is that right now I'm not currently on site. I'm back in the U.S. In Minnesota with some family right now. So that's a big change for me, being off site, but still being able to provide site support and support the virtual volunteer program that HQ has been fantastic of pivoting on and being very successful with. But thankfully, we do have a great site team, and we've been able to maintain much of our clinic operations with few adjustments. We've been, of course, emphasizing safe health procedures like distancing and hand washing and PPE at our clinic. Some of the biggest adjustments that we've had to make are around the outreach program, because going out into communities, into large community settings or community large gatherings is not really something that is great to do right now. But we've been able to put more emphasis on health education activities at our clinic. And as well too, we have been able to maintain some outreach activities in a safe way in more distant settings with smaller groups, because it's still very important to share knowledge around COVID awareness, and as well the other health-related topics that are still important to keep on our radar in times like this as well.
It's definitely great to hear how like adaptable as an organization FIMRC has been, and I think like from the roles that both of you previously mentioned, I think it also comes from the fact that like FIMRC does cover like a wide range of aspects when covering global health, and it really does widen what global health means. So it is really nice that as an organization you've been able to kind of adapt to the circumstances.
That said, have there been any big or even small challenges that you've had to face in making these adjustments during the pandemic?
Absolutely. There are certainly a lot of challenges that we've had to face, depending on the specific country, depending on the community that we're working in, the challenges do look different. And so a lot of our sites, just the simple impact of quarantine has caused us to pause certain operations, and certain site staff can't actually go out to do their work. For the majority of our clinic sites, they have been able to continue in some way, shape, or form providing those clinical services. Like you heard from Nick, Uganda has been able to continue. Our site in Costa Rica has actually been able to continue its clinical services and psychology services through telehealth and telecommunications. Similarly in Ecuador with our psychology services. And so some of our sites have been able to really adapt. But of course, for some of our other sites that are our partnership sites where we don't have clinical operations as a focus, because there's not that health, we're not seen as a healthcare organization, we're seen as a public health organization. There aren't special permissions given to our staff members, and so they aren't able to go out and perform those health education programs, which is important, but at the same time is understandable because we're not supposed to be gathering in groups and things like that. And so that certainly has been a challenge to be able to figure out how we can still maintain a connection with the community and continue our work while following the protocol implemented within each country.